and welcome back to another installment. We're going to be talking about doctors and ailments, and I'm Dr. Pearman. Now, I'm not that kind of doctor that helps you with your medical ailments, so just remember that if somebody says doctor, it doesn't always mean that they're an MD or an DO, which are the two different kinds of medical doctors. Okay, let's get started. First question, what's an ailment? An ailment's anything that doesn't make you feel 100%. So an ailment could be a disease, or it could be a genetic condition, something that makes you feel not 100%. So let's figure this out. But first, let's do a quick review. See if you can answer this question. Okay, hopefully you came up with Run, Mr. Sliced, because we're going to go through each of Run, Mr. Sliced and look at which system it is, which doctors would be there, and what are some of the common ailments, health conditions that you might see with each of these systems. So R, the first one stands for the respiratory system. Remember, breathing. There's going to be our lungs, our diaphragm, our nose, and the trachea, getting the air in, so on and so forth. So who is it you would see if you had an issue with your lungs? This one's a weird one. It's a pulmonologist. Okay, well, this is a doctor that I see. I have asthma. So I have a pulmonologist that I see, and he's actually triple board certified. And he's triple board certified in the fact that he can deal with lungs, and he's a pulmonologist. But he is also certified to be an allergist, because if I smell cut grass, for example, I'm highly allergic to grass, that is going to cause me to have an asthma attack. So you can see why these two would go hand in hand. The other part that he is an immunologist, so he looks at the immune system. He's also my son's doctor. When my son was little, he had a problem with his lungs, with asthma, but he also had a problem with the fact that his body wouldn't accept the vaccine for pneumonia, and he had walking pneumonia so many times as a kid, and it was bad because every time you get pneumonia, you can get scarring in your lungs, which is not a good thing. So after about 8-9 times of having walking pneumonia, we saw an immunologist who looked at, and it was this immunologist, allergist, pulmonologist, this one person that does it all, and he looked at how my son's body was reacting to the vaccine and the fact that it wasn't storing the information. So he worked with his immune system and got him so that he was now protected against pneumonia, the vaccine. And knock on wood, he's been great ever since. So there's one more that I like to point out, an ENT. The ENT stands for ears, nose, and throat. Ear, nose, and throat. Well, why is that part of the respiratory system? You got it. Not because of your ears. We don't breathe through those. But we breathe through our nose and through our mouth and through our throat. Now, here is the cool word. Are you ready for it? An otorhinolaryngologist. Whew, difficult to say. Say it with me. Otorhinolaryngologist. So oto being ears, rhino being nose, and laryngologist being your throat. Cool, right? It's a good Jeopardy one. Good question. All right. So they're the doctors, the main doctors. Yes, there's loads of others that could potentially be working within the respiratory system, but they're the main ones I want to talk to you about. So let's talk about some ailments. I've already mentioned asthma. This is where you get a constriction of the little tubes inside your lungs, and then it makes it really difficult to breathe. I want you to know this next term. Hello, I want you to know this next term. COPD. This stands for chronic obstructive pulmonary disease. This is an umbrella term, and so things like emphysema, chronic bronchitis, these are going to be in this umbrella. These are going to be situations whereby your lungs are not functioning very well, and so this is a chronic obstructive pulmonary disorder. We talked about pneumonia. Well, what is it? Pneumonia can actually be a viral or a bacterial infection that gets inside your lungs, seals themselves off, and then it causes you to have less volume to be able to breathe. Makes you pretty bad. Bronchitis, that's inflammation of the tubes inside. Why on earth did I put hiccups? Well, Hiccups are an important part of the respiratory system. This is where you get mixed signals from your brain to your diaphragm. And so as your diaphragm's doing its thing, trying to breathe, all of a sudden it gets an extra signal from the brain. It goes, hiccup. And another term is a diaphragmatic spasm. Kind of fun. All right. Sinusitis. Remember when we drew that crazy picture, my self-portrait? We have those sinuses. These are going to be cavities in the nasal area that fill with air. And if you get pressure or inflammation in here, it could be because of infection. Now, I want to point out that I have cancer here in quotation marks, not to do anything against cancer. Cancer is a horrendous thing. And we respect cancer. The reason why I have it in quotation marks is because there are so many different varieties of cancer. You can get oral cancer, you could get cancer of the larynx, of the throat, you could get it in the nose, you could get it in the lungs, you can get cancer basically anywhere. And so that's why I have it in quotation marks, nothing to make it any less than it really is, because this is a nasty. But there are so many different versions of it that I just wanted to kind of like encompass. There are many cancers that affect this system and each system. Okay, move on. Here we go. Hopefully you know it stands for the urinary system. Okay, who would you go see? Well, if you had an issue with your bladder or maybe your kidneys or where you pee out of your urethra, you might see a urologist. But if you have a problem with the inner workings of your kidneys, so they're the nephrons, they're the functional units, they're the bit that actually do the sorting, you would see a nephrologist. Ooh. And if you have really bad kidneys that are no longer functioning and you need dialysis, you might see a dialysis technician. That's whereby they're going to take your blood out, run it through a machine instead of your kidneys, because your kidneys aren't working. It will filter it a bit and then put it back into you, which is kind of cool. So what are some common ailments? Well, a UTI, urinary tract infection. This is whereby you get bacteria that goes up your urethra and then it causes you to have pain and aggravation and could have blood in your urine, and it could go up into your bladder, and it doesn't stop there. It could go up into your kidneys and cause a kidney infection. Yikes. Did you know that cystitis is actually the term for a bladder infection? Cyst means is the bladder, and it's used kind of interchangeably with a UTI. Okay. Kidney stones. Now, my poor husband has kidney stones, and I will tell you all about his kidney stones when we get to the urinary tract, urinary system. And but basically, the big thing is you don't want them. And can you prevent them? Maybe. Especially if you look at your diet and how much water you're drinking. Be careful there. All right. And bladder infections, one and the same, right? So cystitis. I want to point out that I have some prefixes, and I'm going to tell you about prefixes and suffixes as we go along. So I want you to know neph and rena. These are two prefixes. A prefix is the beginning part of a word. They begin and a part of the urinary system. So neph and rena are to do with kidneys. I told you another one. Cyst. That's bladder. Okay. Suffix. This is the end of the word. And itis means inflammation of. And typically that inflammation is going to be quite often caused by a virus or a bacteria. Ooh. Okay. Inflammation of. All right. Let's see, can you remind me what kind of doctor you would see for asthma complications? How about the nervous system? Oh, I gave it away. Nervous system. So I want you to make sure that you think about what all the nervous system is involving. Which organs are in that? Is there more than just the brain? So if you did have an issue with your brain, who would you go see? Well, I would go see my neurologist, right? But if you had an issue with, let's say, personality or with a mental health disorder, you might see a psychologist or even a psychiatrist. But remember that these are to do with our brains, our nerves, our brain. But there was other things to do with it. Why on earth did I put down an optician or an ophthalmologist? Well, they're your eyeballs. Remember, these are going to be our sensory organs that bring in the input into our brain. So here, an optician deals with our eyes. I saw an optician to get my glasses. Hooray! So I can see the computer. Yay! I'm very glad of it too. So an optician. Now, please note, please note that there is a star by the optician. I wonder why I put a star there. Make sure in your notes you put a star by the optician, because we're going to come back to why I put stars by some of these. Okay, moving on. So let's think, what other doctors could there be? We did eyes. How about ears? An audiologist, right? They help us with sound, with hearing, with our hearing tests. Do we hear correctly out of left and right, so on and so forth. And then another one that can help us with our ears, but also our snifter and maybe our taste, our good old ENT. I wonder if you remember what it stands for. Ear, nose and throat, or an otorhinolaryngologist. All right, what are some common conditions that we could have? Well, let me just remind you, first of all, before we get there, that a psychologist and a psychiatrist, they get easily confused. So a psychologist, these are going to be the ones that have a doctorate, but they do things more in terms of talk therapy, whereas a psychiatrist has the ability to prescribe. A psychologist doesn't. A psychiatrist does. So sometimes we might like, which one's which, right? Psychiatrist can prescribe. Psychologist is going to just be talk therapy, okay? All right, so let's talk about some ailments. There is one I want you all to be very, very familiar with, and that is a stroke. Now, there are two main types of strokes. This is whereby there is a blood vessel inside our brain that either bursts or clots. So if it bursts, it's a hemorrhagic stroke, and if it clots, it's an ischemic stroke. Now, if we've got blood that's bleeding out and it's not delivering the blood to the part of the rest of the brain that kind of needs it, that part of the brain's going to get hungry and it's going to stop working. Same thing if the blood is blocked in an ischemic stroke, then the rest of the brain isn't going to get the blood it needs. It's not going to get the oxygen, it's not going to get the nutrients, and it gets hungry and starved, and, well, it shuts down. Now, there are some really important signs and symptoms of a stroke that you need to know about. And we use the little mnemonic device, be fast, right? So if somebody is coming out and they're like, and they're wobbly, right? And their eyes look changed, right? They're blurry, they can't see properly, and they've got loss of balance. Well, yeah, okay. You might have seen people that have been a little inebriated that have that. Okay, but this has nothing to do with having too much alcohol or anything, right? There's another part. So you need like majority of these symptoms to be like, oh, that's a stroke, right? So there's asymmetry in the face, so this face will drop. Now, just because somebody's got a face does not mean that they're having a stroke. Sometimes if people have Bell's palsy, or that they have a scar or a migraine, it can actually cause like part of their face to droop. But combine that with the loss of balance, the eyesight's being blurry, and arms weakness. If you put both arms out, they should be equal, you hold them. But if you've got a stroke, one arm is not going to hold up, and so you have this lopsided weakness. Now, this speech difficulty could be one of two things. One, they could be talking to you saying, I have a really bad headache, I don't feel well, what's going on? And it comes out as blah, 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 blah. Or it comes out complete gibberish. They think they're saying, I've got a really bad headache and I don't feel very well, and it comes out as unicorns, purple, bicycles, and sunshine. What? Right? They can't. Okay. And the last one, I like to say it's both time and tongue. If you ask somebody that's having a stroke to stick their tongue out, it'll go to one side. It won't go straight. They won't realize that it's not straight and it's gone to one side. So if somebody is having a stroke, it used to be curtains. It used to be big problems. Like there was nothing that could be done about it. But now, amazingly, if you can get to the hospital and if you're having an ischemic stroke where it's a block, they can give you a clot busting drug within 2 hours and poof, it takes away the stroke. If people had had a stroke previously, they might be left with one-sided paralysis, they might be left with all sorts of conditions that would be very problematic. But now, because of modern medicine, we're doing amazing things, right? We're saving lots of lives, we're saving people from having debilitating symptoms as a result. And so it's really important for time. Okay. So 911 at that point, right? We're going to call an ambulance. We're going to get them to the hospital and get them treatment. Now, amazingly, these strokes can happen on a mini basis. They are called TIAs, transient ischemic attacks, meaning you get a little blockage and then poof, it dissipates in itself. My grandmother used to have these. So when she was in her nursing home towards the end of her life, she kept getting these little TIAs. And so my mum would go in and see her and she'd be like, "Hi, Mary, how you doing?" And she would be doing okay. And then the next day after she's had a stroke, she might not be able to talk or might not be able to recognize my mum. And then the next day, she was fine again because the brain rewired. Another time she went in and Gran couldn't feed herself. She couldn't move her right hand. And the next day, she was fine again because the brain rewired. Amazing neuroplasticity. Ooh, that was a good word, wasn't it? It is ability for it to regenerate and can make different connections, but to a certain extent. Okay, so these ones we don't want to happen either. Okay, concussions. Ouch. These hopefully you never have, but yes, these are quite common, particularly if you're playing contact sports. We're going to talk more about concussions later. Tumors, yep, absolutely. An aneurysm's a burst blood vessel. And then you can get into things like Parkinson's disease, or you could get into Alzheimer's, where you have a change in the brain, its structure itself. We're going to talk more about these other conditions later. Okay. And of course, vision issues, hearing issues, because again, this is part of the nervous system. Okay, let's keep going. So, true or false? The T in fast, or be fast, stands for temperature. M, of course, in run, Mr. Sliced, M stands for muscular. Okay. So if you have an issue with your muscles, who do you go see? Well, I have had issues with my back, and I have gone to see a wonderful person who is a physical therapist, and she helped me to strengthen my back muscles and to make sure that I was better in alignment, and brilliant. But a massage therapist is also an excellent resource. I've also seen, for my muscles, a chiropractor. Let's think why. Because if you remember, our skeletal muscles are attached to our bones. And if our bones are out of alignment, then it puts our muscles out of alignment and vice versa. So it's very important to have everything aligned. Okay. Let's keep going. All right, so who else? Now, bones, speaking of, if I had a problem with my bones in general that maybe a chiropractor couldn't reset, I might see an orthopedist because they're bone specialists, right? Okay, here's one that you may not really think of. But have you ever heard of a speech therapist? Why would it be in the muscular system, no speech? Because all of this talking is based upon muscles moving in a particular way to regulate the sound that's coming out from my voice box that is now undulated into speech. Pretty cool. Another one, an occupational therapist. So with Sarah, my niece, when she had her brain surgery and they took out part of her brain, and she had to relearn how to talk, how to walk, and how to do things like write again, feed herself, open door handles. So the speech was done by a speech therapist, the walking was done by a physical therapist, and the things like opening a door handle, feeding yourself, that would be an occupational therapist that will help you to do the regular stuff in life. So let's see, what ailments would be common with the muscular system? Hopefully you don't ever pull or tear a muscle, but that's possible. Tendinitis, itis, inflammation of the tendons. And what do tendons do? Remember, blob and bottom, bone, ligament, bone, tendon, muscle. So attaching the muscle to the bone, it can get inflamed. Muscle spasms or cramps. Dystrophy, that means that it's just not working, and you atrophy, it's now stop working, right? Dystrophy, pain and non-working muscles. Ouch. Okay. Question. Muscles require an energy molecule in order to pull, because that's what muscles do, right? They only pull. And for every muscle that pulls, there's a muscle going in the opposite direction, pulling to one do. So the question is, what molecule is the energy molecule that allows this pulling to occur? Let's make sure you spell it correctly too. All right, so the R, run, Mr. That second R is the reproductive system. Now there's a little symbol there. When I was a little girl, I had no idea what that symbol was, and I said to Mum, what is that? He was like, it's for a boy. And I was like, well, why? He was like, because boys have pointy bits coming off them because they have a penis, and girls, they have their symbol is their circle with their plus on the bottom because they're mummies and they have their arms open to give them hugs. Now, the first bit about that boys have pointy bits and a penis coming off, when I was about 6, I was horrified, and I've never forgotten it. But the mummy thing with the arms open, that kind of helped a little bit. But yeah, I've never forgotten that. I expect she doesn't even remember that it stuck with me so well. But anyway, so male reproductive system. That's the one we're talking about. Now, here's a real fun question. We've already talked about this doctor. Which doctor would a gentleman go to see about his penis and testicles? The answer is a urologist. Why? Because the penis does double duty for both ejaculating and urinating. And so therefore, the doctor needs to be able to understand the functionality of this one organ that does both things. Pretty cool. But there is another doctor that is specifically for males, and that's a proctologist. And they deal a lot with the prostate gland, which we ladies do not have. Okay, so common ailments, you can have prostate issues. As you get older, it enlarges and can cause problems, particularly with the constriction of your urine flow, and it can go into prostate cancer. Erectile dysfunctions, that's the inability to get an erection or difficulty in getting an erection, impotence. And then sperm issues, that you don't have enough sperm, they're not swimming hard enough, they don't have the numbers. So reproductive issues. Okay, and of course, there's cancer issues with this too. So here's the little circle with the plus sign. That's the little mummy with the arms open going, I love my children. And this is the female reproductive system, of course. Okay. So who is the doctor that deals with us? Is it a urologist? Not for our girly parts. No. They only deal in both for boys. So the one that goes for us is an OBGYN. This stands for an obstetrician gynecologist. This doctor is actually double board certified. They are certified both in women's reproductive health with and without pregnancy. So who is it without the pregnancy? That is the gynecologist. But when you are pregnant, or you're getting pregnant, or you've just had a baby, or they're delivering your baby, right, you would see an obstetrician. Now, most women will go to an OBGYN because they will take you through your entire reproductive life cycle before, during, and after pregnancy. But there are some women that just don't want anything to do with babies, and they just choose to go to a gynecologist, and that's a-okay too. Please note, there is a star with this one. All right. Now, if you did not want your baby delivered by an obstetrician, by a doctor, you might want to see a midwife. They're trained in delivering babies. Or you might even have a doula. These are there to help being a coach, a birth coach, very homeopathic alternative medicine kind of route. Okay. Now, there's one more that we need to know about, a mammographer. They are the people that do the breast squishing in the mammograms, and we get a breast squish at the age of 40, and it takes like 2 minutes, if that. It's a little bit uncomfortable. You put your breast tissue in between two plastic or perspex that's squished down a little bit, and then this x-ray machine goes around you. Now, you're meant to go every year after the age of 40 to just check your breast tissue, but it's really important also not to be reliant upon that, and you should be doing breast checks every month, all the time, even from now. And gentlemen, you too, although a mammographer is predominantly female, boys can get breast cancer too, and so you can also get your boob squished by a mammographer and have them x-rayed to make sure that there are no lumps and bumps in there. But again, self-detection is key with breast cancer. I had a great friend of mine who is amazingly cancer-free now, but a number of years ago, she had a mammogram, came back clear, and then about 2 months later, she noticed a lump in her breast, and she was like, whoa. So when in doubt, get it checked out. So she went to the doctors, and they're like, oh yeah, it's fine, we'll wait till your next mammogram. Well, it waited another month. She was like, I don't like this. It hasn't gone away. So she asked for an ultrasound. They did, and they found out that, yep, it was cancer. Now, had she have waited for another year for that mammogram, the cancer would have been significantly worse to battle, would have been larger, could have spread and metastasized to her body. So she was amazing, and she self-advocated, and she was like, something's wrong, and she did it. So yay on her. And because of that, and because of her proactive approach, she is now cancer free, and she's a warrior. She's amazing. Love her. Yay. Okay, so what are some of the common ailments that could afflict the female reproductive system? I'll come back to the lactation consultant in a moment. We could get something like, you know what? I'll come back to the lactation consultant right now. Lactation consultant, if you remember, lactation is the production of milk. Well, when you have a baby, you don't always know how to hold the baby, get the baby to latch on, and it's really kind of like trying to juggle this whilst... So a lactation consultant is somebody who is trained in helping mothers breastfeed, and totally okay to have help. Totally. Do it. Okay. Now we go to ailments. So endometriosis. This is where some of the cells inside your uterus go walk about onto other organs. Kind of painful, pretty nasty. You can get cysts in your ovaries, in your uterus. You can get problems with lactation, mastitis. This is where you get an infection in your breast tissue, and it happens quite often when you're breastfeeding. Infertility issues, reproductive issues, and again, yes, of course, there's cancers throughout the female reproductive system. So with the female reproductive system, there are quite a few things that can go wrong. Okay. The S stands for skeletal or skeletal. I'm English, but I've lived in America for probably 3-4 times as long as I've lived in England, and I still can't remember which one's English and which one's American. So you can tell me, skeletal, skeletal, you're bilingual now. There you go. That's my present to you. So if you have an issue with your bones, we've already talked about it, you would go see an orthopedist. But you might also want to see an orthodontist. Fix your teeth, because your teeth are part of the skeletal system. You want to make sure that they're grinding nice and straight up and down. Otherwise, if they're kind of you could wear them out, right? And have difficulties chewing. So you might also want to see that chiropractor again. Ooh, I've got a good one for you next. Are you ready? You ever heard of a rheumatologist? They deal with joints, so the meeting of two or more bones. So the inflammation of the joints, you could have something called arthritis. And this is a rheumatologist would help deal with that. Pretty cool. I bet most of you have not heard of every single one of these by now. And they're like, wow, there's a lot of doctors. There are. And I'm only picking a handful. There are lots and lots and lots of other specialties within medicine. Amazing, right? And a radiologist, of course, is going to read the imaging that's done. And a lot of times it's going to be things like x-rays or MRIs, CAT scans. ultrasounds, and they're going to be able to read to see what's going on internally. And a lot of times it's going to be reading bones and bone images because they may be broken or fractured, or you're having a torn tendon, or your cartilage is sloughed off or ripped. Okay, problems. Now you could also have a problem with your ligaments. So swan neck is kind of a cool thing where if you overextend or damage your ligaments in your fingers, instead of your finger doing this, it goes in the opposite direction. You get a swan neck. Ouch. Sometimes it needs surgery to repair. Sometimes it just heals on its own. Arthritis, we talked about. Inflammation within the joints. Scoliosis, this is where you get curvature of the spine, right? Kyphosis, you get a humpback. Rickets, this is kind of neat. This was used to be really prevalent, and this used to be because people were very low in vitamins, particularly like vitamin D and calcium, and they would get these really terribly bowed legs. Ooh, thankfully, we don't have that so much now. Okay, L, the lymphatic system. Okay, there is actually a doctor called a lymphologist. Cool. But the one that I like to think about are the immunologists, so the immune system, and an oncologist. You need to know an oncologist. These are the cancer doctors. So an immunologist is going to talk about how you fight off those infections, whereas an oncologist is going to be fighting off cancers. And a lot of times those oncologists are more specialized. So why did I put it in the lymphatic system? Because unfortunately, if somebody has cancer, it can spread through the lymphatic system. And so this was just a perfect place to put the word oncologist, because they deal a lot with the lymphatic system, such as a lymphoma or a leukemia, or even breast cancer that's metastasized into the lymph nodes. Okay, so other than cancers, which are quite prevalent, or immune issues, right? You could get something called mono or mononucleosis. Now, why did I put this here? Because mononucleosis is going to affect your lymphatic system, particularly your spleen, and then your lymph nodes. You blow up, right? These glands blow up really big, and you get really, really tired, and you get a headache, and you feel really cruddy. And this virus, in England, it's called glandular fever, because your glands get inflamed and you get a fever. Well, kind of a cool thing, right? But it's under an umbrella term of a number of viruses called the Epstein-Barr virus, okay? The Epstein-Barr virus has mononucleosis, it has the cytomegalovirus, it has a whole lot of different viruses under it, and they all kind of do the same thing. They make you feel horrible, right? And they make you really tired. But the reason why I'm bringing up mono is because this one affects your spleen. So if ever you've had mono, they might press on your side to see if your spleen is enlarged, because if it is, you're not able to play contact sports, because if you boom, hit your enlarged spleen, it could rupture, and then you would need a splenectomy, the next word, where it removes the spleen. You can live without a spleen, but you don't want to, because it holds all your immunity, right? Okay, so lymphatic system, pretty cool. Oh, that was the other thing. My brain's catching up. Mononucleosis. This is a virus that is going to stay in your body and that you can have again. Most people, if they get it once, they're probably going to get it again at some point. When your body is run down, when you're really tired, when you've got another infection, because this virus stays inside your cells and duplicates, and every time you make your cells, it also makes the virus, and it lays there dormant, waiting. And then all of a sudden, you're feeling not well, you're super stressed, you've not been sleeping properly, you've not been eating properly, and then, your immune system has been suppressed, and this virus comes back out. Most people will be able to fight it off after 2. There's a few people that have had it 3 times. I'm just a wackadoodle. I've had it 4. Maybe that's because I was born inside out. All right, the integumentary system, my failed system at birth, right? So, integumentary system. This is going to be your hair, your skin, your nails. So, the first one I put down, who's going to help you? A hairdresser. not to make you all coiffed and everything, but they can actually help you with, say, itchy scalps or nits or problems with your hair. How about a plastic surgeon? They help to repair scars or to change appearances of the skin and the underlying fat tissue and structure. But the main one I'm sure that you're thinking about is a dermatologist. Oh, look. Do you see the stars? Do you see that it's got a star next to it? Ooh, I wonder what that means. I'm not going to tell you yet. All right, so a dermatologist, they can deal with nails, they can deal with skin, they can deal with hair, they can deal with scalps, they can deal with the entirety of the integumentary system. Okay, so some of the ailments, right? We said nits. These are those lice, right, that get in your hair, that you might have had those nit checks or lice checks when you were a little kid in lower school. Dandruff, psoriasis in your scalp, that sort of thing. Alopecia, do you know what that is? That is hair loss, right? This is where you lose your hair, and this is due to, usually there's a genetic condition where you're not able to grow hair or you lose the hair. Eczema, inflammation in the skin, right? Itchy. Acne, yeah, that's a problem, an issue, an ailment of your skin. Melanoma, skin cancers, right? Staph infections, we've got staph all over our body all the time. But when you get cuts and you've got nicks and whatever it might be, your integumentary system fails, and that infection can get in and cause you to have a nasty infection that you might need some antibiotics for. Another one that's similar to that is impetigo. Children that wear wet diapers or that are going through potty training and have urine in their nighttime diapers on their bottoms for too long, it can cause them to get a sore raw bottom, and then it can get the infection of the skin bacteria into those sores, and it causes them to have spots. So I call it a spotty botty because their bottom has got spots all over it, right? So this could be impetigo. But remember, you could get impetigo anywhere, but children are quite prevalent of getting it because of their diapers and whatnot. Vitiligo, this is a skin disorder whereby the pigment in the skin is attacked by your own body thinking it's foreign, and so you lose pigmentation in places. Okay, weird, right? But again, an interesting thing. Question time! See if you're still with me. What's another word that I said that described mono or mononucleosis? It's the words we use in England. Ooh. Okay, C. Now, the C stands for both the cardiovascular or the circulatory system. I don't mind which one you use. What is this? This is your heart, your blood vessels, and the blood. So who would you see? You would see a cardiologist. Yeah, that's for the main workings of your heart. They also deal with the blood vessels, but the blood vessels and the blood contents would be more seen by a hematologist. Hemo meaning the hematologist being the blood doctor, right? Or you might see a vascular surgeon if you've got issues with, I don't know, varicose veins or something. Your blood vessels not working properly, you might see a vascular surgeon. Or you might go and see Dracula, a phlebotomist. They draw your blood, right? If you take the advanced class, you might become a certified phlebotomist. Ooh. So yes, you can draw blood and you can do all of that fun stuff. Okay. Or you could see a cardiothoracic surgeon. If you ever watched Grey's Anatomy, Christina Yang, Dr. Burke, right? They were cardiothoracic surgeons. They deal with surgery in the heart and the lungs. Pretty cool stuff. So what are some of the common ailments with the cardiovascular system? We can have things like heart attacks. Well, we don't want one of those, right? There could be a heart murmur where the valves don't close properly. An arrhythmia where instead of your heart going boom, 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 it might be boom, 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 boom. And so you're boom, Boom, boom. So your heart is not beating correctly, and this is an arrhythmia, heart disease. So inside the blood vessels that are surrounding your heart and feeding your heart, they can get clogged. Why? Because of genetics, because of food, because of lack of exercise, because of stress, because of alcohol, because of smoking. So many reasons, right? And then if they block up, atherosclerosis can happen, and then you could get a heart attack as a result of this heart disease. A hole in the heart. I did mention this before. When a baby is developing, it divides in two halves and joins in the middle. But people like me, that I didn't join properly in the middle at my abdomen and my guts fell out, or my second cousin who joined in the middle incorrectly, both in the abdomen but also in the heart. And he had a hole in the middle, and that allowed the oxygenated and the deoxygenated to mix. That's bad, right? So that wasn't so good, and he had to have that closed up too. You could have issues inside your blood, like sickle cell anemia or anemia. I want to talk about a DVT. DVT, deep vein thrombosis. Okay, this is a blood clot. Okay, ladies, I have to tell you, you are more prone to a DVT than gentlemen. Why? Because we are more likely to be on birth control pill. And if you're on birth control pill and you smoke, really high risk of getting a DVT. So this is whereby blood pools into an extremity, maybe a leg, maybe an arm, something like that, and it clots. Well, that's bad enough because it's not letting the blood flow go to the rest of the extremity, back to the appendage. But the worst thing is when that blood clot breaks up and then it travels around the body. If it goes into your heart, it could cause a heart attack. If the clot goes into your lungs, it causes a pulmonary embolism and causes you to, not breathe, kind of need to breathe. Or it could go into your brain and cause a blockage, an ischemic stroke, right? It's going to cause an issue. So we don't want DVTs. So how do we prevent those? One, diet, exercise, being on the pill only if, and being under medical control, blah, 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 blah. No smoking. And if you are sedentary, meaning sitting still for a very long time, move around, wiggle. You might have a little Apple Watch that says, time to stand up. Well, it's a good thing because we don't want the blood to pool in our extremities. It used to be that on airplanes, there used to be chair exercises, particularly on long haul. So I used to fly to New Zealand where my parents were living for quite often, and they on the flight you would see that it would be time for chair exercises, and so you would see all the people raising their arms and raising their feet and stomping, and this was to help circulate the blood going around so that it doesn't pool and get your feet fat and okay. Cool. And a hematoma, I just like this word. A hematoma is a big collection of blood, but it causes a bruise. One and the same, a bruise, hematoma. It's a hematoma. Okay. Thinking back to our skeletal system, what does blob and bottom refer to? Ooh. Can you get it? E is the endocrine system, and these are going to be, remember that really long list of organs that were part of the endocrine system? In the pituitary gland, the master gland, you had the thyroid, you had the hypothalamus and the thalamus and the ovaries and the testes, and their main thing is that they're going to produce hormones, and these hormones control all the metabolism in the body. And who controls making sure that that works right when it goes wrong? It's an endocrinologist. Well, they're pretty cool. They're really, really clever people because all of the details of every single hormone have to be in perfect balance, because if one goes off, then it makes a snowball effect and causes an avalanche of issues going to the... Oh, they are so smart. Interesting fact, a valedictorian from our school, she went on to become an endocrinologist. She was super, super smart lady. Super smart. And I'm not surprised. Very, very smart. Anyway. So what can you have issues with? I just put it as big hormone issues because there's such a long list of hormone problems that there can be. But the one I really want you to know about is diabetes. Diabetes is when inside your pancreas, it does not produce the insulin or the glucagon that's needed to regulate the blood sugar. And so it causes very, very big problems. So there are two types of diabetes. Type 1 diabetes is when your body is like, oh, that's a foreign cell, attack, and thinking that the cells that are making the insulin are foreign and needed to be destroyed, right? Not human, not my body, get rid of. Well, they were actually really important. Thanks, body. This is an autoimmune disorder. But the second type is whereby you have consumed balloons. No, it's not a good thing. Second type is whereby you get you've ingested so much sugar and you've bombarded this pancreas and it's worked so hard that it waves the white flag and it says, no more, I give up. No, can't do it. I quit. And then, yeah. So there's a possibility that you can get your pancreas to come back online if you change your diet, your ways, and you give it a little rest, but not always. So just be careful. You've only got the one pancreas. You can't live without it. Be careful. And then I said the pituitary gland is the master gland. And there's one more thing I want to tell you about. This thyroid gland. Did you know it's actually really susceptible to X-rays? So if you get an X-ray of your foot, your leg, whatever it might be, they give you those lead aprons that cover up your reproductive parts. If they don't have a thyroid guard, ask for one. They should have it, and they'll just put a little lead over here, and it protects that thyroid from going a bit dodgy because it's had X-rays. Okay. Don't panic if you've had an X-ray and you've not had this thyroid guard, but just going forward, like if you have to have another one, ask for it. Okay. D. It stands for my favorite system, the digestive system. Hooray! Okay, these are my favorite people in the world because these are the people that keep me living and keep me functioning. And I think they're geniuses. And they are gastroenterologist or a gastrologist. So a gastroenterologist, we break this word down. Gastro is stomach, entero is your intestines. So they deal with your stomach and all of the intestines and all of the working, right? And a gastrologist deals mainly with the stomach and the stomach working of the stomach. Pretty cool, right? They keep I keep them in business because mine doesn't work, so they need to figure it out. You might also see a nutritionist. They're very knowledgeable about what nutrients you need to put into your body to keep it functioning and to healthy and working, which also is similar to a dietitian. Now, that doesn't mean that they're going to put you on a diet. A diet is actually what we eat, not the restrictive kind, like a Jenny Craig diet, right? We're talking about how we get the nutrients into our body. I like talking about a hepatologist because they deal with your liver. Have you ever heard of a HEPA filter for your air conditioning? That's a super filtration filter that cleans it all out because that's what your liver does. HEPA meaning filtering. Okay. Or have you ever heard of a bariatric surgeon? These are people that deal with those that are, let's say, morbidly obese, and they can reduce down the size of the stomach through surgical intervention, and it helps them to eat less and they would lose weight. They're kind of cool. And then, of course, a dentist, because why? Your teeth are part of your dentition, is part of your digestive system. You can't really eat without your teeth, right? So you have a dentist. Oh. Did anybody else notice there's not 1 star, but there's 2 stars? Oh, yes, this might give me some balloons. There are 2 stars at, yay, balloons, 2 stars. 2 stars. Well, I'll tell you about those in a minute. Just make sure you got your 2 stars there. Okay. So what are some of the common ailments that you might have? You might have issues with your teeth. You could have issues with the salivary glands, right? They're producing saliva. Gingivitis, that gets you inflamed gums, give you bad breath. Your acid reflux, you get ulcers in your stomach does stop working, Crohn's disease, colitis, IBS. This is an umbrella term meaning irritable bowel syndrome that can cause with diarrhea, you're pooping out too much, it's liquidy, or constipation, you're not pooping out and you're pooping out boulders or hard rocks, right? Not going on. Hepatitis, I wonder if you could be really clever and think, which organ would that be? Itis is inflammation of, and liver. So inflammation of your liver. So hepatitis could be caused by a virus called hepatitis, or hepatitis A, B, C, D, or E. There's lots of versions of it. Or just inflammation due to another reason. Okay. Cirrhosis, it's scarred the liver. Appendicitis, we've talked about that. Gallstones, pancreatitis. Can you see there are a lot of different things here with the digestive system? Whew. Oh dear. So we don't want to have any issues of those. How do we prevent those? Diet, exercise, water, taking care of ourselves, going to see a dentist, going to make sure that we see a general physician. Ooh, let's talk about this. A PCP, it stands for Primary Care Physician. Now, this PCP may be in an adult, a GP, or an internist. But if you are a child or a baby, or you want to go with your parents to the same doctor, you might see a family physician. But if you just want to go and see a doctor that's designed or designated for just kids, you would go see a pediatrician, but they would still be your PCP if you were a child. Now, most of the times that you're a child, it would be from newborn through to 18. In some cases, they'll accept up to 21, and in some rare cases, they'll accept to 25. But usually about 21, you're going to find your own regular family doctor or an internist or a general physician. Okay. So before the pediatrician, have you ever heard of a neonatologist? Neonates, newborns, or premature babies, that's who they deal with. And the other end of the spectrum, have you ever heard of a gerontologist? They deal with old people. No, I'm not old enough yet for a gerontologist. These are going to be people that are 65 plus, right? They're going to be in the later years, right? I'm not there yet. How about, have you ever heard of an anesthesiologist? You might have heard that they put people to sleep for medical procedures, but they're also there to help with pain management. Have you ever heard of an EMT? This is an emergency medical technician. They are going to be people that are like in the ambulances that help to take you to the doctor or the emergency, right? Pretty cool. So not just doctors are needed. We need all sorts of people to help run the medical practices, including the nurses, the unsung heroes of the medical profession. They're amazing. Nurses are incredible. Okay. Have you ever heard of a chiropodist or a podiatrist? You know what they deal with? Well, I can't lift my foot up, but it's a foot, right? They deal with your feet. Pretty cool. Okay. It is time. It is time to finish this unit and to move on to a silliness. Okay, you are going to have a crazy few times. Yes, I do expect you to get up. I do expect you to do this. Because why? Because you need to move that blood around. Okay, we just talked about it. Don't get a DVT. Don't get, it clogged in your bottom. You need to go back to your brain. So you can play this silly game.
Yoo-hoo! It's time for a brain break, the games where we energize our body to ignite our mind. This game is called Two Types of People. Don't forget to like this video and subscribe to our channel for more great games. In this game, you're going to choose what type of person are you, type A or type B. You'll have 10 seconds to pick the side and 20 seconds to do the matching activity. Here we go with round one. How do you like ketchup with your French fries? Are you like side A and pour your ketchup over top of all the fries? Or side B, make a puddle and dip it?
I'm a side B.
If you pick side A, you get to punch the speed bag. If you pick side B, you get to do squats.
It's hard to do squats while you're sitting. So stand up and do squats properly. Or you can do your punching bag.
On to round two. When you set your alarm, you're side A if you only set one alarm. You're side B if you have to set 4 or 5 alarms.
I'm a B again.
If you pick side A, you get to do standing toe touches. If you pick side B, you get to run in place.
Come on, if I can do it, you can do this. Let's go.
When you eat a chocolate bar, you're side A if you just bite into it, and you're side B if you break it into small pieces.
I do both. I break them into bigger pieces and then eat.
If you pick side A,
Maybe I'll
you
do
get to do squat
balancing
punches.
and
If you
squatting
pick
at the
side
same
B,
time.
you get to balance in star pose.
All right. See if you can do it. Balance. I think
When it comes
that
to
might be good. All right. On to the next thing. Let's talk about insurance. All right. This is going to be a doozy. But of all the lessons, this is probably one that you need to know a lot. And you will refer to this information from here on out. So I'm going to give you a little brief overview. There is a lot more to insurance. So if you are having questions, go back and ask your family members. See if the information that I am going to discuss with you matches that of what you found out about your insurance, and make sure that it's matching up. And if it's not, then you can always ask me, or you can always ask your family members to see where the discrepancy is. But insurance is going to be something that is super, super, super important. I think that was probably the biggest thing that was hardest for me, is coming to America and assimilating, remember that word, to assimilate into this culture, is learning how to do the insurance. Because in England we have socialized medicine. It doesn't cost us anything. We don't really need insurance. But over here you absolutely do. Now, when I'm talking about insurance, there are lots of different types of insurance, right? So you could have your car insurance that you're required to have. You might have insurance on your pet. You might have insurance on a boat or your house, but that's not the kind I'm talking about, right? Yeah, that's important to know and understand, but the kind I'm going to talk about is medical insurance, and only medical insurance are we going to talk about today. Okay. So the big question is, how do you get this insurance, right? How do you get insurance? Well, there's one option, is you can self-pay. You can buy it. So if you're like a small company, you might be able to buy your own plan, or you might be able to get it through one of the government programs. So, for example, if you're over 65, you might be eligible for Medicare, which is a government federal program that gives medical assistance to those over 65. Or you might be Medicaid. So let's say that you're a foster child in the foster care system. Those children are eligible for Medicaid, just as an example, or people that can't afford it's a federal and state program that helps to provide medical insurance for those that need assistance. Okay, now there was the Obamacare, which is the Affordable Care Act, and again that provides more opportunity for medical insurance. A lot of details of that, but just basically the be all and all is that this helped to promote medical insurance policies for more people. And then you also have CHAMPFA and TRICARE. These are to do with military. And again, you might get your insurance through government agencies, such as through the military. Okay, or the most common way of getting your medical insurance is part of your employment benefits. So your employment benefits are going to be additional to your salary. So when you go and get your first job, you might like, woohoo, I'm making X amount of money. Well, that's great. But you have to realize that that's not what you're taking home. You're only going to be taking home a portion of that, because some of it's going for taxes and some of it's going to go to your insurance. But when you're looking at your employment benefits, right, you want to see what employee benefits you're going to get. So how many vacation days? How many sick days are you going to get a year? Okay. And then what insurances are going to be provided and at what rate by your employer. So medical, dental, They don't have to, right? They don't have to provide dental. They don't have to provide vision, and life insurance. These are extra ones. So if you've got two companies, you should not only just look at their salary, but also their benefits to see which not only fit is going to be better for you, but what benefits in the long run are going to be better for you. Because it could actually make a big financial difference. All right, so let's keep with this employer-employee benefit. When the employer is going out and it goes to different insurance brokers and says, which insurance company are we going to use? They have a lot to choose from. There are a lot of insurance companies that are going to be available to provide different plans. So they select, okay, let's say I'm going to choose Blue Cross Blue Shield. That's the oldest insurance company in all of America, interestingly. And interestingly, Blue Cross Blue Shield is done by individual states. So if you've got insurance Blue Cross Blue Shield of New Jersey, it's going to be different from Blue Cross Blue Shield of Florida. The umbrella company is the oldest. That's all I know. All right, so here we go. So let's say you've got Blue Cross. Now the company, your employer, has got the opportunity of selecting what plan that they are going to have. So let's say you were going to go and buy a car. You've chosen to go and buy a Ford. Are you going to buy a Ford F-150, a Ford Explorer, a Ford Escape, or a Ford Festiva? I don't know if they still even have those. That was my first car. So the choice, the plan, right? So you've chosen which company. Now you're going to choose which plan. There are a number of different plans, but the two that I want to focus on are the HMO and the PPO. Okay. So the HMO, it costs less up front. So it's going to cost the employer and employee less money to have it, to buy this plan. But there are more restrictions. Fewer doctors accept it, and usually there is a referral that's needed in order to see a specialist from your PCP. With the PPO, you have more doctors that will accept it. You have less restrictions, but it is more expensive up front, typically. Okay? And the PPO is more likely to allow you to go out of state, and so outside of whichever state you're in, Florida, and to different doctors. So as I said, more doctors will accept it. Okay. So what is this premium? This premium is the amount of money that it costs to just have the insurance, to own the plan. So how much money does it cost to buy the car? You're not running it. You're not doing the maintenance on it. You're not doing anything. It's just you own this car now. Okay. So this is the plan that you are owning, but it is split between you and your employer. So you pay a portion and your employer pays a portion. And again, that's agreed upon by the employer and varies from company to company. So just pulling up some information that I found, if we look at this particular payment plan, this is for every 2 weeks. This is the amount of money that's extracted from a paycheck. So if it is just the employee only, and you have that first column, and you're right here, this first column, if it's just the employee only, and you're looking at an HMO plan, that's the cheaper one, that is the one that is more restrictive, it's $144.50 every 2 weeks. But if you went to the PPO plan, that is going to allow you to go to outside of the state. It's going to allow you to go to more doctors, less restrictions. It's more expensive up front. And you can see how the prices continue going up and up and up as you are adding more people, so a spouse or children, a child or children to it, or as the family to the spouse and children. Okay. So this gets a little confusing. So I'm going to give you a scenario that might help. So let's say, poor Dr. Pearman, my tummy hurts. And I need help. Okay, so what am I going to do in order to go and get medical help to fix my sore, poor tummy? Number one, I need to have, first of all, my insurance, which means I need to pay my premium. That's that split cost between the employer and the employee, and that I need to make my monthly payments or bi-weekly payments is extracted from my salary, and it just goes directly to the insurance company to pay, to say, yep, you own it. But now I go to the doctor. Well, I got tummy ache. Which doctor am I going to see? Ooh. Do you remember, what does PCP stand for? Do you remember which tummy doctor would be the correct one? Okay, well, hopefully you remembered that the PCP stands for the primary care physician, and the specialist would probably be a gastrologist or a gastroenterologist, right? So, okay, I want to go and see one. Well, if it's the HMO I have, I'm going to have to see the PCP, my primary care physician, my general physician, internist, family medicine doctor, to see if I'm allowed to go and see the specialist first. That's the first thing. Then, if I've got the PPO or a non-referring HMO, I can just go straight to the gastrologist. Knowing me, and I've got tummy troubles, I'm probably going to go and see the specialist. Well, when I get there, they're going to ask for a copay. The copay is the set amount of money I need to pay for my visit. Now, had I gone to see my PCP, my primary care physician, that would be cheaper than going to see the specialist. So if you see here, it would be $25 to go see my primary, or to see my specialist, it would be $45, almost double. Why? Well, the specialist requires more money because they charge more because they were in school longer, right? And they're more specialized so that fewer people come to see them, right? Important stuff. Notice that it doesn't matter whether or not it's an HMO or a PPO, that I have the same cost between the two. Okay. Now, this payment is the case for whenever I need to go and see a doctor, with the exception of our annual well visits. Bum, bum. It's free. Hooray, I love it. Why? Because when I go for a well visit to my doctor, they want to make sure that I'm doing well, because it's easier to catch and treat something early than it is later, and it causes you to have, more costly if you've gone after the fact. If you could catch it young or catch it in the infancy of the disease, it's much easier to treat, it's quicker, it's cheaper than it is down the road. Okay, and causes more complications, more costs. So they want you to go and see these doctors to get a checkup. So now, what do you think those stars meant? Ooh, those stars that we had talked about when we talked about our doctors were which doctors you should visit once a year. So your PCP, either your general physician or your pediatrician, being, depending upon your age, you see once a year. You're going to see a optician once a year. You're going to see a dermatologist for your skin once a year. Why? Because we live in Florida, people, and we need to have mold checks, because that sun out there is really brutal, and we need to make sure that we're doing okay, and they check our moles to make sure it's not gone bad, and if it does, get rid of them before they get worse, right? We don't want them to spread. Do you remember that I had another one by the OBGYN for the females only? Right, gentlemen, you don't need to go to them. So we girly girls need to go and see an OBGYN once a year, every year. When? Well, I asked them specifically, and they said, go if you're having difficulty with your menstrual cycle, go if you are sexually active, or go if you are between the age of 18 and 21 and have not been sexually active. Those are the sort of times that the OBGYN would like to see you. Or if you've got concerns or questions, go anytime, right? Okay. And then you might have noticed that there were 2 stars next to the dentist. Why? Because you're meant to go every 6 months, because that 6 months helps to keep your teeth clean and healthy, but that also helps with your heart health. So it's really important that you should keep your teeth clean for the rest of your body, and particularly your heart. Whoa. Okay. So it's not a sick visit. It's not it's not a well visit. So if it was a well visit, I would have a zero copay, zero, nothing, nada. I wouldn't pay. But it's a sick visit because my tummy hurts, right? In this scenario, I'm going to go to see my doctor and I will pay my copay. Okay, so I went to my doctor and I saw him because I paid my premium, and I'm still paying my premium every 2 weeks. And then I paid my copay at the time of the visit. And now my doctor would like me to get some imaging and blood work done. Fair enough. Okay, so where am I going to go? So I'm going to go to LabCorp or Quest. Which one? Well, it depends upon which insurance I have, and the insurance card will tell me. So Blue Cross Blue Shield, United Healthcare, I'm pretty sure they're Quest, okay? I'm not sure about the other ones, but that you would need to look it up, because it would be horrendous if you went and made an appointment. Let's say you're fasting, you're not eating, you make an appointment, you go to LabCorp, you sit there in the waiting room amongst all the other people that are sick and coughing in, and then they call you up and are like, oh, your insurance is for Quest, not for LabCorp, and you need to go and make a new appointment with them, and you've done all of this, you've got time off work, you've fasted, you're grumpy, you're hangry. I'm not speaking out of personal experience at all. No, not at all. Oops. Yes, I did have that happen. So since then, I have been very good about making sure that I go to the one that I meant to go to. Okay. Sometimes the insurance allows you to go to either, and then it's personal preference. But notice that the charge for going to the blood work, it could be a copay, or it's no charge. It depends upon which blood you're having taken. Well, how do you know which one it is? Well, you kind of have to ask. So again, you have a copay. Now, this is also the same case for if you have to have imaging. There is usually a set amount with imaging. Now, this is going to be, if you look on the HMO, it is $350 for an MRI. For the PPO, it's slightly cheaper at $200. We'll get to this outer network later, but slightly cheaper for the PPO. Why? Because you paid more in the premium, okay? Now, the advice, go to a freestanding clinic like Midtown Imaging or Reyes Radiology. Don't go to the hospital, because the hospital will charge you significantly more. And the same thing for blood costs. You need to make sure that you're going to go to Quest or LabCorp. You could get it done in the hospital, but again, it's going to be more expensive. And you need to know which blood you're getting taken. And you can call up your insurance and be like, do you take this? Is this going to cost me anything? Because there are going to be certain ones, like certain genetic testings, that the cost of this isn't covered by your insurance company, and the cost comes back to you. And so you might go thinking, okay, well, I'll get this test done just to be safe and get peace of mind. And then you get a bill for $350, and you're like, whoa, that was an expensive peace of mind. And again, I'm not talking about experience or anything. Yep, I'm teaching you from my learned, behaved and ways that I've found out the wrong way, the hard way. Here we go. So I went to the doctor and I paid my premium so I could go see him. I paid my copay, and I paid my copays at the imaging. I got my imaging and my lab studies done, and now the doctor's like, you know what, I think we're going to do an endoscopy. This is where they stick a camera down your throat into your stomach to have a look to see what's going on in there, and you're going to have to go to the hospital, and they'll call to schedule. Oh, okay, that sounds expensive. So now it comes to the time that we talk about the next category of payment. This is a deductible. Not all insurance companies have or plans have a deductible. It depends upon whether or not your premium is higher or lower. The higher the premium, the lower the deductible. Okay, so a deductible is basically like a set amount of money that you are responsible for paying before the insurance company kicks in to help you. These are for big ticket items. So things like the MRI, that goes towards the deductible. Things like this surgery, they would have a deductible. This is the set amount of money that I need to pay before the insurance company kicks in. Okay, so it's like this piggy bank. where I'm needing to pay out all of this money before all of a sudden the piggy bank is full, and then the insurance company takes over, and we then do the next bit. Okay, so this is big ticket items, and it is set in your plan. So if you look in this example again, for the HMO, my deductible for a person was $1,250. For the PPO, it was $1,000. So that meant that if I just have the PPO, it's $250 less. But if you remember how much more that PPO was in the premium, you have to balance. Is that going to be worth it if I have to have a big item operation or something? And family, that means that if I as an individual pay $1,250, my daughter pays $1,250, then my son, if he has to pay a deductible, he's free, right? Everything else is free because I've met the maximum. Okay, so go back to my scenario. I'm still paying my monthly premium, or every 2 weeks I'm paying my premium. I paid my doctor my copay. I paid my copay for my imaging and my blood work if I had it. I now had my bill for my endoscopy that met my deductible, but my bill for my endoscopy at the hospital was much more than just the set amount, let's say the $1,200 or $1,000 that I was meant to pay. The bill's bigger than that. So what do I now do? I now pay my coinsurance. So the coinsurance is where we split the bill. So the remainder of the bill after the deductible's been paid, after I've paid my little piggy bank out, I have got the remainder of the bill. And it will be split typically in a ratio of about 80-20. In some cases for less premiums, the coinsurance rate is worse, being 75-25 or 70-30, but most typically it's about 80-20, meaning that of the total bill, I pay 20% and the insurance company will pick up the majority at 80%. Now, if we want to make these coinsurances and the deductibles less, then we tend to use a plan that's got a higher premium. But you pay more if you use it, but pay less up front, and that's the lower premiums, right? So they're people that are really, really healthy, unlikely to use it, but is there as a safety net. You might use one that's a low premium. But if you know that you're going to use the insurance a lot, you might want to pay more up front so that every time you use the services, they're not as high a rate. Again, it's going to be something that you have to look at. How often are you going to use the medical insurance? It's kind of almost like a gamble. You have to kind of think, well, how healthy am I going to be? Okay, so the coinsurance is split. So my tummy's still hurting. I've had my endoscopy. This means I've paid my coinsurance, I've paid my deductible, I've paid my copays, I'm still paying my premium, I don't give that up, and now I've been sent home with prescription medication that I need to go and get. But where do I get it from? This is where we talk about prescriptions. Prescriptions come in different tiers. So a tier 1 drug is going to be something that's like a generic. That means they're like off-brand. So think about it when you buy Rice Krispies. Can you buy Kellogg's Rice Krispies? Or right next door to it for a significantly cheaper price is the Publix owns Crispy Rice, right? It's actually made of the same exact stuff, just put into different boxes. Comes off the same factory line. Most of the time it does, right? So a generic formula is whereby the drugs have gone through all of the testing process and they've gone through manufacturing, research, development, and they cost millions and millions and millions of dollars to create new drugs. Well, there's a proprietary information about how to make this drug, but it only lasts for a certain number of years. And then after a certain number of years, they have to release the secret formula. And then other drug companies can come in and make it, and it makes it cheaper, and that's where you get the generic drugs. an in-between time of where we've got the specialty, it's brand new drug, right, to where it's this generic version. These are going to be based upon how much it costs to make and manufacture and how much more they need to recoup from their costs and so on and so forth, and which is why we've got the different tiers. And with the different tiers, you have a different copay amount to go along with it. So typically you might have a copay of about $10 for a generic drug, and you might have copays of hundreds of dollars for the specialty drugs. I once was prescribed a medication that we thought might help with a migraine I was having, and the doctor prescribed me 4 pills. And when I got to the pharmacy, he said to me, he's a friend of mine, he was like, are you sure you want these? I was like, why? He was like, they're $200 a pill. I said, no thank you, I'll have a headache. All right, so you can choose the tier. So if you go and the doctor's like, oh, I'm going to prescribe you, and you're like, is there a generic formula? You can be an advocate for yourself and ask for something cheaper. Yes, you can. The other thing that you need to think about is where you're going to buy it, okay? So in Publix, you might not know this, but there are some drugs that are free. So if you get, let's say, an amoxicillin, an antibiotic, you could get it from Publix for free, or you could go to CVS or Walgreens and pay your $10 copay. I know which one I would prefer. So some of them are free. The other thing that you could do is there is a list of drugs that are $4 at Target and Walmart, a flat fee of $4, and you don't go through your insurance necessarily. So you can look and be self-advocating and be like, oh look, my prescription medication that I need to take is cheaper at Walmart or Target. I can go there. Or Costco's, if you didn't know that. Did you know also Costco's does veterinary, so doggy pills, cat pills, and that sort of thing? Kind of interesting to know. And the last option that you could do is mail order. So if you know that you're taking a medication that you take every day, like this is a continuous thing, you can actually get sent to you 3 months for the price of 2 through mail order, which can help reduce down in cost. Okay, again, how do you know this? You have to be your own advocate and do your own research. Whew. Okay, yeah. Keep going. My scenario, here we go. I've done the endoscopy, I've paid my deductible, I've paid my copay, I've paid my co-insurance, I'm paying my copays for all of my medications, my prescription copays. And then all of a sudden, I get horrendous pain and need immediate medical attention. What am I going to do? Well, I have a choice. I need to think, am I going to go to the urgent care or am I going to go to the emergency room? Amazingly, the urgent care can do stitches. It can cast broken bones and take x-rays. The urgent care is pretty cool in the fact that it can help you with all sorts of different ailments and problems. But there are cases whereby you go to the emergency room and you go to the emergency room only. Do not pass go. Do not collect $200. Just go straight there. So if you are having chest pain or if you are having an asthma attack or severe anaphylactic reaction, allergic reaction, if you've gone unconscious, if you've hit your head and you now are unconscious, right? If you've cut off a limb, if you're having a stroke, seizures, uncontrolled bleeding, go to the emergency room, right? Do not go to the urgent care because they're just going to call an ambulance and send you to the emergency room and they're going to charge you, right? So do yourself a favor, just go to the emergency room. So me, in this case here, I need to think, which one am I going to go to? I've got severe abdominal pain. Well, probably need the emergency room. But if it was, let's say, that I stood on a sea urchin spine, not that I've done that. I stood on a sea urchin spine. We were out on the Peanut Island, the sandbar, and I was walking in the water without shoes, and oops, I stood on a sea urchin and its spike went into my foot. Well, this was not a limb-threatening emergency. I didn't cut my leg off, and I knew I could go to the urgent care. Well, there was reasoning in my brain as to why I went to the urgent care the day I stood on a sea urchin versus why I went to the emergency room with this abdominal pain. Okay, so with the urgent care, The urgent care is significantly less money. So if we look here, the urgent care is $45 or $50 to go to the urgent care. Whereas if I was going to go to the hospital, an emergency room visit is $100 or $200 just to walk in the building. Now, here's the other thing. If you're in the emergency room, in certain plans, you have to pay for each doctor that sees you. So let's say you go in with an asthma attack and you see the emergency room doctor, then you see the radiologist, you see a pulmonologist, and then they change emergency room doctors and you have a new one. You might have 4 specialist co-pays to pay in addition to the facility pay. You can see why it would get very, very expensive. The urgent care, however, is a one flat fee of about the specialist, significantly less money. Time. With my sea urchin situation, I was in and out, having been seen, having had it extracted from my foot, patched up, and a prescription for medication, and sent on my way within 45 minutes. Had I have gone to the emergency room with my poor 4 Tootsie Toes, right, I could have been waiting there for up to 8 hours. 8 hours sitting in the waiting room with all these sicky people around me, watching the more important cases of people having heart attacks and strokes and seizures and limbs, and yeah, go fix them. My poor foot can wait. Right? It still hurts though, and I want to be seen. Go to the urgent care, right? Okay, so time. That's 8 hours to be seen, and then I would need another few hours to be able to see the doctor and get maybe an x-ray if need be, or to get the surgical part to remove it from my foot. And so I could be like 12, 16 hours in emergency room versus 45 minutes. I know which one I would choose, and did choose. And this is a great word, a nosocomial infection. The time that you are taking gives you greater exposure to a nosocomial infection. This means that you have a greater chance of getting a secondary infection, okay? A secondary infection. So if you're in a waiting room with all these sicky people that are really, really sick, you're more likely to pick up what they got. So, right? But if you're in an urgent care, less sick people go there, so you're less likely to pick up a nasty bug, and you're in and out in significantly less time. That's why time's on there twice. It's not a typo. Yeah. But have you ever thought about an ambulance? They are so expensive. Now, ambulances are not necessarily in your plan, and you might get a bill from the ambulance company directly. So ambulances are not always covered by insurance. Now, can you imagine the cost of a medevac, like a helicopter that comes and picks up and delivers you? Tens of thousands of dollars, not covered by insurance. You're liable for it. So I once was called, I had an asthmatic issue, and I was in my pulmonologist's office, and I kind of passed out, whatever, right? And they called an ambulance on me, and they took me a quarter of a mile. That was it. And I got a bill for $900 that I was responsible for. It was rather expensive. It was a very expensive quarter of a mile. I kept thinking about all the limousines I could have taken. Oh, never mind. So, there is a situation I'm going to tell you about. Appendicitis, my dear friends. We've talked about this before. That little appendix in the bottom right-hand quarter, lower right quadrant, right? You guys are prime age, 8 to 21 prime age for appendicitis. Why? We don't know, right? It just does its thing. We just have to listen to our body. Now, if you get this pain in the lower right-hand quadrant, kind of pain in the belly button region, kind of radiating pain into the back, you got nausea, you got vomiting, you don't feel well, malaise, right? Do not go to the urgent care. This actually happened to a friend of mine. She went to the urgent care. She wasn't feeling well. She had these signs and symptoms. They're like, come in. It would be a copay of $50. And then they're like, well, we think it might be appendicitis. We're going to send you to the hospital. Should we call an ambulance? And she had heard from me about my ambulance visit. She was like, no, I'm going to take myself. So she drove herself there, or she had a husband driver there. and she saved the cost of the ambulance, right? So that was probably another $1,000 saved. And she gets to the emergency room and she has to pay the copay for the emergency room. Well, now it's 2 copays. I know $50 doesn't seem that much, but in the grand scheme of things, it's also your time and you're now delayed treatment. So she gets to the hospital. Yes, it was appendicitis. Yes, she had to have it out, and she was all sorted. Hooray! But if she had gone straight to the emergency room, she would have been sorted quicker and didn't have to pay that secondary copay. Okay. So here we go. I go to the hospital because my situation is I've got severe abdominal pain, and with my complications and poor tummy, right, I'm going to the emergency room. So I paid my emergency room fee, but because I was admitted in this scenario, they actually credited me back that cost, because it can cost like $850 a day to be in the hospital. That is really expensive. And they determined I needed a massive open abdominal surgery. They need to open me up and take it all out and fix what's going on. Yeah. Were you singing money signs with me right then? Were you a little panicked, like a big abdominal surgery? That's going to be expensive. Yeah, expensive. So I will tell you that I have had 2 big abdominal surgeries. Well, I've actually had 4, but whatever. The last 2 were pretty long and extensive. And one of them, this was a number of years ago, so I can only imagine how much it would be now, was $500,000. Now, I don't know about you, but I don't have $500,000 sitting just like, oh, I don't know what to do with this $500,000. Here, I'll just use it for an abdominal surgery. No. Okay, so of that $500,000, I had paid my premium to keep my insurance. I'm paying my co-pay to go and see the doctors. I paid my deductible off, and then I paid the 20% co-insurance of the $500,000. That's still how much money? No, I don't have 20% of $500,000. Nope, still don't. So there is a part of your benefit plan that says the a total family out of pocket and individual out of pocket. So if you look here, this is the line I want you to see, the individual out of pocket. So if I was on the HMO plan, which is the lower premium, my maximum amount that I would pay after I paid my deductible, after I filled my piggy bank, right, I would pay $5,000. So the insurance company wanted to, the hospital wanted $500,000. I would only pay a maximum more of $5,000. And then the insurance company would pay the rest. Well, the hospital doesn't get paid the rest of the $500,000. They have negotiated agreed rates. And so in reality, I think they only paid about $17,000 of the $500,000. And so that was it. Now, here's the thing. I will not pay another cent to prescriptions, to anything else for the rest of the year once I've met my out-of-pocket maximum. Okay, and that's the same thing for my family. So if in my family I meet my out-of-pocket max, my daughter meets her out-of-pocket max, then my son, even if he hasn't used any money, he won't pay anything for the rest of the year because it's met the family level. But here's the important point. It resets every year, which means that if you know you are going to have some big surgeries, let's say you know that you've got some big surgeries coming up for your legs, your teeth, whatever, you want to get it done early in the year so that you meet your out of pocket early in the year, so the rest of the year it's free, because come December 31st at midnight, bing, it resets and everything goes back to zero. And I will tell you that it is incredibly frustrating and upsetting when you reach the out of pocket maximum on December 31st. Ouch. So let's make sure that we understand. My tummy was hurting. I've gone and seen all of my doctors, and now I've paid all that I'm going to be for the rest of the year. I can see all my doctors and get all my medications, do all my labs and imaging, and everything will be free because the insurance company said, you know what, you've paid so much money this year, we feel sorry for you. No more, you don't have to pay anymore. But that's until next year, and then it will reset again. Okay, so, but please note that it's not totally and utterly I've got no money coming to the insurance company. I'm still paying my premium every month. Now, in this scenario, I wonder if I could go and see a specialist doctor, let's say in Cleveland at the Cleveland Clinic. I wonder if my plan will allow it. So this is where we need to talk about in-network versus out-of-network. So in-network, do you notice that in this particular scenario, the Blue Care one, the HMO, is in-network only. This one here says that I can only go to doctors with the agreed upon rate, and I can only see them. There is no out-of-network benefit. Okay, which means that the doctor has to agree to accept this type of insurance. But in this blue options, which was the PPO option, which is at the higher premium, it had both an in-network and an out-of-network option. Notice that the costs are much higher for the out-of-network, right? And the responsibilities are almost double. Look at that. Family out-of-pocket maximum is $14,000 versus $7,000. Almost double, well, double there and almost double for everything else, right? Very much more expensive. That is because these are doctors that I could see, but they don't have the agreed rates that the doctors that are in network do. And so they cost the insurance company more money because they said, no, we're not going to agree to your rates. That's too cheap. I want to charge this amount of money. And so the insurance, if you have an out-of-network policy, it says, okay, well, yeah, you can go and see these extra doctors that don't normally take the insurance. But the extra cost it's going to take to go see, we're going to pass it back to you. So if you really want to go see it, you can. Well, why is this important? Well, in case you need to go and see somebody like at the Mayo or at Cleveland Clinic, right? But the other thing to make a note of is that, yes, it is expensive, more expensive to do that. But there could be also an issue with location. So for some of these HMO plans in particular, they not only limit you to in-network, they also limit you in state. So if I go up and visit my children in college, right, and I'm on an HMO plan, as soon as I leave the state of Florida, I do not have insurance if I was on an HMO plan. So with them being out of the state, I had to make sure that they're on a plan under me because I'm their mum and they're on my policy, that they have to be able to see a doctor in a different state, right? So this particular plan here wouldn't work for me because I have a situation where I've got kids in other states. If, however, I knew I was a Florida person, I wasn't going to leave Florida, then this might work for me. Okay, so again, we have to weigh up our options as to which plan works best for us. Okay. Now, here are some things that you are responsible for. You are responsible for knowing if the doctor or the facility, like the hospital or the imaging place, is in network and takes your insurance. How do you know? You call them up and say, hey, do you take Blue Cross HMO? Do you take Cigna? Do you take United Health? Do you take, right, and you tell them what you have. And they will tell you yes or no. If they say no, you can't go to them. No, I wouldn't. I would find somewhere else. You need to pay the copay at the time of the visit. But here's a word to the wise. Keep the receipt, particularly if you're paying in cash. This has happened to me 2-3 times whereby I pay my copay at time of visit and then a month later I get a bill for the copay saying I didn't pay it. I was like, yeah, I did. And I was like, well, we don't have record of you doing that. And so I either produced the receipt or because I used my one credit card, I was able to pull up my credit card statement and produce it to them. And like, oh, I'm so sorry, our mistake. Because not all billing departments are in the office. They might be in a different city, even different state, whereby they're doing this generalized billing and things can slip through the cracks. And don't let you be one of them. So always having a receipt to say, yep, I already paid it, and then they'll apologize. But if I didn't have the receipt and I didn't have proof that I paid it, guess who's liable? Me. Know if your doctor has been billed or paid. How do you know this? You check an EOB. This is the explanations of benefits. That's how I could tell when I had my $500,000 surgery that they only paid $17,000 is because I looked on my EOB. So how do they have this big discrepancy? Well, it's because the hospital or the doctor's office will write off this extra amount of money that they didn't get, and it helps with tax benefits. Kind of interesting, right? But if you did not have insurance and you went in and got a $1 million surgery, guess who's liable for that $1 million? All right, make sure you keep all your medical records. This includes any images. Get a disc, okay? If you get an MRI or x-rays, or ask for a disc. It's going to be important. I'll tell you why in a minute. Get your blood work. Make sure that if you've got it on a portal, say Quest or LabCorp, that you download and save the blood work results, and that you've got a basic understanding of your vital signs. So when you go into the doctor's office and they take your blood pressure, ask what was it, and just keep a mental note so you kind of know where you run. Okay, where's your body temperature? Because then if it's out of whack one day, you'll be like, whoa, that's weird, right? So why are we taking in taking account for the imaging, right? Why do we need all of this? Well, let's say that you broke your arm in 7th grade, right? And you've got pins in there or something, or realignment or whatever it might be, right? When you go off to college, if you have another injury or an accident, and they'll be like, oh, well, you've got something going on here. Yeah, I did. They need to have the images of what you were like before the next accident, right? So if you have it on hand and you go to the doctor and you're like, okay, this is where I'm coming from, this is my previous history, here are my images, then whenever you have anything going wrong with you currently, right, or in the future, the doctor has the records to compare to. If not, then they're like, oh, well, we need to see those records. They then have to write to or call up your former doctors, and wait for them to send them the imaging, and it takes time. So any time that you're going to go and visit a new doctor and you've got a medical history, bring your medical history with you so that you can go, this is me, this is what's happened, and this is where I'm going, so that they don't have to wait for that information. Because you know what's going to happen? You're going to have to go back and pay another copay. Save yourself some time and money and effort. Do the due diligence beforehand. All right. And knowing that, it's really important to know the names and addresses of your providers. They're all of your doctors and your pharmacy, because when you go to the new doctor and they're like, oh, which pharmacy do you use? It's useful. So keep it in your phone maybe, okay? And then it's really important to know your allergies and medications. So whatever medications you're on, keep a list of it. And also if any known allergies, I make myself a document. And on my document contains my list of my doctors, their phone numbers, addresses. I give a list of what current medications I'm on and a list of all my allergies. And that way, when I go to a new doctor, I can just print it out and be like, boop, there I am. Or when I'm trying to fill out the new patient forms, I've got everything there without having to look them up. It's really quite useful. It has saved me so much effort by just keeping up with this one document. Okay. Other considerations. You may have heard of AFLAC, right? The duck. What is that about? Well, this is supplemental insurance. So you can get this supplemental insurance to cover you in case you have an accident, or you have a long-term disability, or you can have it for different policies. So there's a cancer policy, there's hospitalization policy, there's a pregnancy policy. So let's say that you get the accident policy, and I have this one and I find it very useful because I'm kind of accident prone. So anytime that I have an accident and it costs me a co-pay and it costs me time and effort and maybe supplies or whatever it might be, AFLAC, when it's an accident and it fits their criteria, will pay me more than my copay. So it's a set fee. And so I kind of almost, I don't want to say I make money on it, but it pays for my copay and any other supplies and time and suffering that I have when I have an accident. It actually makes me feel a lot better about the fact that I'm very accident prone. I have another one where if I'm hospitalized for over 24 hours, AFLAC will pay me some money to help offset all of the other expenses that I have. And you can have all sorts of different policies. And again, this would be something that to look into that might be useful for you. The last type of insurance I want to talk about here is workers' compensation. This is usually provided by your employer, that if you get hurt on the job, you don't use your own personal insurance. You rather use the insurance that they have for on-the-job accidents. So if you slip and pull your back on a wet, slippery surface on the job, or if all of a sudden you're driving a forklift truck and something falls on you and the forklift truck falls over and you have to go to the hospital, whatever it might be. I don't know. I'm coming up with some random stuff here. All of those costs of the copay, the co-insurance, the deductible, all of that is going to be covered by your employer, and you just have to go through the workers' compensation doctors, right? This is a different network of doctors that accept workers' comp. And so, yeah, so if there's a policy, so you don't actually have to use your own money if you get hurt on the job. But preferably you're safe on the job and you don't have this. But it's nice to know it's there. Okay. Other useful insurances. All right, there are other ones out there. I'm just going to mention a couple. Life insurance. So this is used that if a relative that holds the policy, it becomes deceased, dies, then the people who are named as beneficiaries will get paid out a lump sum of money. This helps to offset the lack of income and the cost of funeral expenses and so on and so forth. So this life insurance may also be part of your employee benefits. So that's an interesting thing. Or you can buy extra. Dental. Yeah, look, all of this doesn't get covered by dental. And maybe you heard me say earlier, and let's see if you remember this, that if you've got multiple big surgeries coming up, such as legs or teeth, that you might want to get them done in the beginning of the year. Aha, dental is not, oral surgery is not always covered under medical. It could be covered under dental, which is a separate policy. Whoa. And again, they have out-of-pocket maximums and co-insurance and co-pays and blah, 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 blah. And it may or may not be offered by your employer. So that's something to look into. Vision. My glasses, oh, that was very wobbly. My glasses, I go for a yearly annual visit because I'm a good girl and I make sure that I go to my optician every year because that's somebody that I should do, and they check my eyes. And every year I am allowed either new lenses or I'm allowed contacts. As I don't wear contacts, I just get my lenses replaced if I need them, and my frames every 2 years. So it's based upon what's written in the contract as to what we have. Again, vision is not always covered, and so this might be something that you have to pay out of pocket. And places like Costco's, they can do it cheaper than, let's say, freestanding opticians or big chains. So there are other insurances, right? Remember from the beginning of our discussion, there are loads of other insurances. You might have insurance against theft, against travel insurance. You might have you have to have car insurance. You might have identity theft insurance. You might have insurance against diamonds and personal possessions. Fire, flood, wind insurance against your house. You might even get pet insurance because they can be expensive, right? And there's a lot. If you're confused by all of this, don't worry. I'm confused too, and I've been looking at this and teaching this and dealing with this for a long, long time, and it just seems like sometimes it's still very, very confusing. You need a degree to understand it. Don't worry. Hopefully you've understood the basics of it so that when it comes time to you going out in the world, you have a fundamental understanding of what the main terms are. So the big ones are, make sure you know that every month you're going to be paying a premium. That's going to be how much you pay every month just to have the insurance. When you go to a doctor or you go to get services or you get a prescription, you're going to pay a copay, which is a set fee of money. If you need a big ticket item like an MRI or a surgical procedure, you're first going to pay a deductible. If your plan has one, they usually are going to be very high premiums, a monthly cost, to have a low or no deductible. But this is the pot of money, that piggy bank that you have to fill before the co-insurance, which is that percentage, split rest of the bill kicks in until you hit that out-of-pocket maximum. Now, I make it sound like the out-of-pocket maximum is where you want to be. Just realize that if you hit the out-of-pocket maximum, you have spent a rainbow ton of money on medical things, and it's not a good thing. You would rather not use your medical insurance. But if you are going to, I have to say that it does feel good to hit that out-of-pocket maximum and then pay nothing for the rest of the year when it's done early in the year. December 31st. I'm still smarting about that. Oof, oof. Anyway. All right, so if you're confused, don't think you're alone. It is a confusing subject. But go back and make sure that what we've discussed here today is matching what you have with your insurance, because each insurance plan is slightly different. So it's really important that you know your insurance, so when you go off to college and when you're off on your own, you don't make silly mistakes and you get huge bills, which you are liable for. And on that positive note, I'm going to end it.